Our next speaker, her name is Denise Gabrielson. So she's actually a board member on our medical advisory board. So Denise Gabrielson is a registered dietitian at St. Michael's Hospital. She's worked in oncology and hematology for over 10 years. She provides nutritional care to inpatients and outpatients receiving treatments for a range of cancers, including gastric cancer. Thank you so much, Denise, for joining us.
Thanks, Katie. I've got quite a bit to talk about today, so I'll just get started. Today we're going to talk about, advancing slides, hang on. Today we're going to talk about the importance of eating well, nutritional challenges that are common with stomach cancer, trying to handle the weight of nutrition recommendations and meet nutrition goals despite these nutrition challenges, managing nutritional status, modifying meals to maximize calories and protein, managing micronutrients, and setting realistic nutrition goals. So nutrition is very, very important before treatment, during treatment, and after treatment. So before treatment, which can include chemotherapy, immunotherapy, radiation, or surgery, good nutrition is important because it helps you to start with stores of important nutrients like protein, vitamins, and minerals to help you keep strong during the treatment. During treatment, eating well and good nutrition can help to maintain your strength, maintains muscle and helps to rebuild damaged tissues, protects against infection, and decreases risk of complications from surgery, helps to minimize side effects from treatment, and can help to maintain your treatment schedule and keep it on track and avoid delays. After treatment, eating well can help to rebuild damaged tissues, can also help to regain strength, and has an important role in maximizing quality of life. We know, however, that as important as these things are, sometimes it's particularly challenging when you have stomach cancer. I probably don't need to tell you how important the stomach is for eating and digestion, but often we don't think about these things until something goes wrong. So the stomach is a key component of the digestive system and has a key role in breaking down food into parts small enough to be absorbed by the body to be used for energy, growth, and also cell repair. When we eat, muscles in the upper part of the stomach relax, and this allows food to go from the esophagus into the stomach. The middle part of the stomach, which is the body of the stomach, acts as a storage area and kind of holds food there until your small intestines are ready for it. In the lower part of the stomach, food is mixed with digestive juices to help break the food down into a mixture called chyme. And this mixture gets released into the small intestine in very small amounts at a time, where it's going to get mixed with further enzymes from your pancreas, which are going to further digest the nutrients and help to absorb them. So when you have a tumor in the stomach, a lot of these functions can be impacted. So depending on the location of the tumor, food may not move well from the esophagus into the stomach. Sometimes digestive juices might escape from the stomach into the esophagus, and that can cause some discomfort. Food may not move into the lower part of the stomach as well to mix with digestive juices, making it harder to digest and absorb these nutrients. So all of this can lead to a feeling of fullness. It can lead to heartburn and indigestion, abdominal pain, nausea, vomiting, and loss of appetite, which are a lot of those symptoms that we see before people are diagnosed with stomach cancer. During treatment with chemotherapy and radiation, there are additional challenges. So because of the treatment, people can have further nausea and vomiting, loss of appetite, feeling full, taste changes, mouth sores, diarrhea, constipation, and fatigue. And during or after surgery, people can also experience loss of appetite, feeling full, dumping syndrome from changes in how the digestive system is working, reflux, dysmotility or impaired motility or things going through too quickly, malabsorption, and lactose intolerance. So sometimes, even though you might know how important nutrition is in your treatment, and no matter how hard you try, because of these nutritional challenges, it's hard to meet your nutrition goals or the nutrition recommendations from others. and this can lead to distress around food and eating. So it's important to consider your expectations or expectations of others and where you are in your disease or treatment trajectory. So, was your cancer removed? Are you currently receiving chemotherapy? Have you just finished treatment? Have you had surgery? What kind of surgery did you have? And is your cancer is your cancer affecting how your digestive system works? And another important consideration is, are your symptoms adequately managed? So you might know what to do and all of the tips for eating well, but if your symptoms aren't adequately managed, you're not going to be able to put those tools into practice. It's important to know that adapting eating behavior takes time. So be patient with yourself. How long has it been since your diagnosis? How long has it been since surgery? You need some time to be acquainted with how your body has changed. And the other thing is to maybe focus on other measures of nutritional health and overall health. So weight is important because weight is an easy and a fairly accurate proxy measure of nutritional health, but it's not the only measure of nutritional health. So some things you might want to consider: are your symptoms improving? Are you able to eat a little bit more than you could before? Are you able to do a little bit more physical activity than you could before without needing to rest? So with treatment options that have kind of expanded over the past several years, survival has also improved over the past several years. And so there's more studies that are starting to look into long-term effects on health-related quality of life. So health-related quality of life is a multidimensional concept, and it's comprised of subjective perceptions relating to physical, mental, emotional, and social health. So in cancer, measures of quality of life include physical, emotional, cognitive, social, body image, and also symptom scales. So studies have shown that overall quality of life usually improves after 1 year after gastrectomy and will continue to improve over 5 years post-gastrectomy. And while symptoms generally improve over time, some symptoms do remain higher even after 5 years compared to pre-surgery levels. So some of these symptoms include fatigue, diarrhea, dysphagia or trouble swallowing, eating restrictions, and body image. And it's important to know that how long these symptoms persist or how severe they are really depends on the stage of disease when the surgery took place, whether there was any preoperative or postoperative chemotherapy, the type and extent of the surgery that was done. So other studies show that quality of life improves within 1 year, with weight improving 1 to 2 years after surgery. So I'm going to focus on talking about managing nutritional health or nutritional status rather than just focusing on weight. This is because, like, as I mentioned, your nutritional status or nutritional health encompasses more than just numbers on a scale, though I will talk about weight loss in a little bit as well, because it is an important part of the whole package. So in general, you want to aim to eat as healthfully as you can. So aiming for enough energy, protein, vitamins, and minerals from foods, but not to micromanage every calorie or every gram of protein or vitamins and minerals that you're eating or putting in your mouth in every morsel of food. Try to just get as much variety in the diet as you can handle. And if you're having trouble, then you can use supplements or nutritional supplements to help to prevent the malnutrition. Avoid any unnecessary dietary restrictions. So sometimes people get advice: don't eat this, don't eat that, it's not good for you, it's very bad for your cancer. Some of these are not evidence-based and can lead to missing out on important nutrients or important food groups that's not necessary. Eat small, frequent meals using high calorie and high protein foods. Limit low fat and low calorie foods, or combine these foods with those that are higher in calories and protein. For example, having an apple with some peanut butter or a handful of nuts. Prioritize high energy and high protein foods first during a meal. So don't fill up on low calorie foods first, and then you may not have room for the more nutrient dense stuff. And look for alternate cues to tell you when your body needs to have some nutrition. So hunger cues may not always be there to tell you that it's time to eat. So some other things that you might want to think about: are you feeling weak? Do you feel extra tired? And how long has it been since the last time you had something to eat? Gradually increasing physical activity over time can help in a number of ways. It can help to preserve muscle mass. It can help to regain strength. It can also help with stimulating the appetite before a meal. So lots of good things with physical activity. And take time to learn to eat and enjoy food again. So that might not be just focusing on calories, but paying attention to how your body feels, focusing on the color of foods, the texture of foods, the taste, and paying attention to your body, to what foods feel acceptable. Give yourself time again to let yourself get to know how your body has changed, especially with how it processes food. This can help to adapt to a new way of eating. And then having an understanding of why you're having some of the symptoms that you're having or nutritional challenges can help with eating and help with expectations about recovery. So let's take a look at the reasons and some basic strategies for managing some of the common challenges. So early satiety is a common symptom that can affect people before treatment, during treatment, and after treatment. So that's feeling full quickly on a small amount of food, and can also be associated with bloating, nausea, pain, and also weight loss. So why does this happen? Most often this happens due to a loss of stomach capacity because of surgical removal. So that can cause you feeling full. It can also cause effects from the tumor on how fast your stomach empties. So this can also cause you to feel full more quickly, or kind of feel like food is just sitting there. It can also happen because of changes to nerve input to the stomach, which may not allow the stomach to relax or stretch to accommodate a meal. So how to manage this? So small frequent meals are often more manageable. They tend to sit less in the stomach. They empty quicker from the stomach. It helps to separate liquids from solids at meals. And if severe, using texture modification, so pureeing foods or using more liquid foods on days where you're really struggling with this early satiety, can help with easier emptying from the stomach. The next common nutrition challenge is dumping syndrome. So this affects 15 to 17% of people after a partial or total gastrectomy, and tends to be more common in people who have had a total gastrectomy. So symptoms are most often prevalent in the period right after surgery, but the symptoms do lessen over time. So early dumping occurs 15 to 30 minutes after eating and is characterized by diarrhea, a feeling of fullness, cramping, vomiting, weakness, flushing, dizziness, and sweating. And this can be exacerbated by foods and fluids that are high in sugar. Late dumping occurs 2 to 3 hours after eating and is associated with weakness, sweating, nausea, hunger, and anxiety. It can also be exacerbated by foods that are high in food and fluids that are high in sugar, and is thought to be related to a reactive hypoglycemia or low blood sugar. So dumping syndrome typically happens because of that loss of storage space that happens after having a gastrectomy, and also loss of the pyloric sphincter, which would be in the case of a total gastrectomy or a distal gastrectomy. So because of this, food in larger particles gets released into the small intestine in larger amounts, because we don't have that sphincter to allow it to go into the intestine in little small manageable amounts. So this can cause fluids to rush into the small intestine, which kind of flushes things through and causes some of the symptoms of dumping. The other issue is when larger particles go into the small intestine, it makes it harder for digestive enzymes to work and make those nutrients into an absorbable form, which can also lead to some of these symptoms. So how to manage this? Limiting foods and fluids that are high in sugar, choosing high protein foods and complex carbohydrates. Sometimes adding soluble fiber to the diet can help to slow transit time. Avoiding fried and greasy foods, separating liquids from solids by 30 minutes, avoiding large portions, eating slowly and chewing thoroughly. So that helps to get the food into more manageable pieces for your digestive enzymes to work. And it takes the place of what your stomach would normally do in terms of breaking those pieces into small absorbable parts. So malabsorption is another common symptom after having a gastrectomy. So it affects about 70% of patients 1.5 to 2 years after gastrectomy. And this happens because of a decreased mixing of food with digestive enzymes. So like I said, having larger particles that end up in the small intestine means they're not as susceptible to the digestive enzymes, breaking them down into absorbable pieces. It can also be caused by a possible decrease in enzyme production. So you have less availability of those enzymes to absorb your nutrients. It can also be due to something called small intestinal bacterial overgrowth. So this can happen when food is moving through too slowly. So it means that the longer the food sits there, there's a chance of having overgrowth of bad bacteria. So symptoms can include diarrhea, cramping, abdominal pain, and weight loss. And some of the ways to manage this would be spreading fat intake over the day. So we don't want to cut out fat completely because this is a valuable source of energy for the diet for maintaining nutritional status. But not having large amounts of fat at once can be more manageable. Sometimes, depending on the cause for malabsorption, modifying the fiber in the diet and including soluble sources of fiber can help to slow things down. And sometimes enzyme replacement therapy can help. So if your pancreas isn't producing enough enzymes or they're not kind of reaching the stomach contents or the contents in the small intestine at the right time, sometimes this therapy can help to absorb your nutrients. So weight loss is common in more than 70% of patients who have stomach cancer and at the time of diagnosis. So before even any treatment has been received or any surgery, the weight loss is very common and can be certainly a big source of stress for people. So total gastrectomy is associated with more weight loss than a subtotal gastrectomy. And weight loss and muscle mass can continue up to 6 months after a gastrectomy. Weight loss is higher in those receiving post-operative chemotherapy. And most patients begin to achieve stable weight after or improvement after 1 year, but it can take up to 2 years for weight to stabilize. So sometimes people get, very worried that they're not gaining weight, 6 months after treatment because they expect that, they'll be able to do that 6 months after treatment. But there's a huge range on when people might actually gain weight. And some people don't get back to their pre-diagnosis weight. So sometimes aiming for a goal of weight stability is more realistic. This is where it's also important to consider other measures of nutritional health, like strength and quality of life. So this slide is an old slide, but a good one from one of my previous presentations. And it just shows that a few small changes can make a big impact on increasing calories and protein in the diet without necessarily changing the amount of food that you have to fit in during the day. I would just want to say that some of these portions will not work for everyone, but it's just more illustrative to show that these small changes can add up to 1,000 calories more and 20 grams of protein more. So as we can see, changing the type of milk from 1% to a whole milk, adding things to the oatmeal like cream, a sweetener, more energy-dense fruit like banana, can help to increase breakfast, changing from a low-fat to a regular fat Greek yogurt, and adding something that's high in protein and healthy fats like nuts. Adding something that's high calorie to a lower calorie food, so adding a little bit of olive oil to a broth-based soup can help to sneak in some extra calories. Adding things like avocado, mayonnaise, pesto to your foods also helps to add some fats to the diet to increase nutrient density. Adding cheese to a snack of crackers, adding olive oil to something that's low calorie like steamed green beans and nuts again, using regular fat dairy products, and adding high protein foods like peanut butter. So sometimes not all of these changes are possible. There are certain instances where decreased appetite, fatigue, decreased gastric motility, or the stomach not emptying properly and early satiety may make liquids a little bit easier to tolerate than making all these changes with solid food. So there are a variety of ready-made supplements out there that are high in calories and protein and also have vitamins and minerals in them. Sometimes ready-made supplements don't work for everyone. This could be due to taste preferences. This could be due to alterations in taste or even taste fatigue. So sometimes people get tired of these supplements. And in this case, making your own smoothies might be a good option. You can also cater to your own taste preferences, and you can also cater to your own tolerances to things like lactose, fat, and also sugar. So you want to start with a liquid. So this liquid could be milk if you're tolerating lactose, or a milk alternative if you're not tolerating lactose. It could be a nutrition supplement. If you want something that's a little less heavy, you could use fruit and vegetable juice or water. And then you want to add calories to your smoothie. So this could be adding a neutral tasting oil to it, high fat things like avocado, cream, ice cream, frozen yogurt, or coconut milk. And then you want to add a source of protein. So this could be skim milk powder, unflavored protein powder, or a flavored protein powder, soft tofu, yogurt, nuts or nut butter, cottage cheese, egg substitute, or pasteurized liquid egg products. You can add flavors by altering the type of fruit that you're putting in. And then you can add extra nutrients if you want. So it could be adding fiber like hemp hearts, flax, bran, chia seeds. You can add frozen greens for extra vegetables. You can control the amount of sugar that you're putting in. And if things are too sweet, you can add a pinch of salt. So there are a few micronutrients that can be issues with stomach cancer. So eating a varied diet is the best way to get the nutrients your body needs. But we know that sometimes the ability to get these vitamins and minerals through food can be affected by chemotherapy and surgery. So this could be due to having difficulty eating enough food or a limited variety in the diet. And also it could be due to changes in the body's ability to absorb these vitamins and minerals. So some of the common ones are iron, vitamin B12, folate, calcium, and vitamin D. So iron deficiency anemia occurs in about 50% of people after a gastrectomy, and it's related to a lack of absorption and also decreased intake. So some good sources of iron are liver, cereals, leafy greens, tofu, and beans. Vitamin B12 deficiency is also common after a gastrectomy, and people will usually run out of B12 stores within 1 year. Sources in the diet include fish, meat, poultry, eggs, cereal, nutritional yeast, and many people often require a supplement. Folate is usually a problem with poor absorption, and you can find folate in leafy greens, legumes, cereals, and grains. You may need a supplement, but it's important to check B12 levels first because supplementing with folic acid can actually mask a B12 deficiency. And then calcium and vitamin D. So this is usually a problem due to decreased intake. So if you have a lactose intolerance and also malabsorption, calcium sources include milk or milk alternatives, cheese, fish, tofu, and leafy greens. And vitamin D sources, which is a little bit harder to get from the diet, include milk, salmon, egg yolks, and cheese. So I want to talk about just setting some nutrition goals. So in summary, when focusing on nutrition goals with stomach cancer, it's important to take time to reflect, as I said, on your body has changed. Understanding the reason for nutrition challenges can help you to set realistic expectations or goals when trying to meet these nutrition recommendations. So what factors are out of your control or unchangeable? Focus your goals on things that you can change or influence. What is a realistic weight goal? So think about where you are in your cancer and treatment trajectory. So is weight gain a realistic goal? Maybe you want to aim for weight maintenance, or maybe even you might just be focusing on slowing the rate of weight loss. And as I mentioned, what are some other measures of health that can inform your goals besides weight? So what kinds of things would improve your quality of life and sense of well-being? The other thing is to celebrate small wins. So this could be maybe being able to go out for a meal with a friend. Maybe you've added one more food to your list of foods that you find acceptable. Talk about your experiences and challenge with others. So don't share the weight of managing these nutrition challenges and recommendations on your own. And be kind to yourself. Lastly, if you're having trouble reaching your nutrition goals or this is causing a lot of distress, reach out to your healthcare team because they can often offer additional strategies to help manage these things. And that's it.